More than 40 tri-state COVID-19 patients have received an infusion of monoclonal antibodies to help keep them from getting extremely ill. But there's a limited supply of this treatment. Deaconess, who's deciding who qualifies for it as positive test results come in. Eyewitness News' Brandon Bartlett reports.
Eli Lilly's monoclonal antibody treatment is given through an IV to help neutralize the virus. It's not given to patients currently in the hospital. The treatment is for high-risk patients who have tested positive and have mild to moderate COVID-19 symptoms.
We do like to give this treatment as early in the course as possible because it's more effective. Ideally, when we give this treatment, it's designed to help keep people from getting worse. Hopefully they get better faster, and not only that, hopefully they avoid hospitalization.
Which is why Deaconess is asking patients more questions when they go in for COVID-19 testing.
If you go through one of our drive-through sites, your COVID test is positive, you'll automatically be screened for these comorbidities and risk factors. And if you qualify, then we will contact you.
Dr. Hunke says this is something they have been doing every day since receiving the monoclonal antibodies on Friday. So far, they have more than 40 patients who have received the infusion at the Deaconess Infusion Center.
Most of the patients that we're giving this medication to are greater than age 65, also have other chronic medical conditions, including diabetes, chronic kidney disease, immunosuppressed states, or overweight.
I think it's been a game changer, and it's sped up my recovery. And frankly, I think it's kept me from getting some of the pulmonary and respiratory problems that I otherwise could have gotten.
It's been a week since Dr. David Schultz received his infusion. He is the principal investigator for this treatment, and he's now on the mend recovering from COVID-19.
Now my body's immune system has taken over to develop its own antibody response against the COVID-19 infection to give me some immunity over the next couple months.
Brandon Bartlett, Eyewitness News.
Now, the federal government purchased at least 300,000 vials so far. Deaconess received 180 doses on Friday and will not be charging patients for the drug.